Well, hello everyone. I actually had a checkup today with Dr. Ibrahim, and I said, you know, I'd be happy to just come and do a testimonial because I feel great. And he said, well, I have a lecture tonight if you'd like to come. And I said, sure, I'd be happy to. I started working under his care about June of last year. I attended a seminar just like this, and I sat there thinking, well, I don't need anything. I feel pretty good. I had a full-time career, a lot of nonprofit activities. I was busy all the time. And as I sat in the lecture, I was yawning because I was tired from my job. And I felt, when I heard him talking about these improvements in life, I thought, well, do I really need that? I feel pretty good. I am 10 years past when I started menopause, and it was a rough ride. I don't know if any of you have gone in there yet, but you don't feel very good. And it takes away your energy and a lot of your enthusiasm for life. And I realized that I was sort of still in that place. I had hot flashes, and I didn't have a lot of energy, and I was moody, and my husband wasn't happy, and on and on. I also was a little bit nervous about starting to put new things in my body, and had heard things about hormone replacement that made me a little bit nervous. But I did some research on Dr. Ibrahim and found that he starts at a very safe level and does blood testing and kind of goes more by how do you feel. So I started the program, and after about the first month I noticed some subtle changes. And first of all, I noticed that I could sleep through the night, or almost through the night. And that was a blessing for me to get back to my normal activities and feel like I had more energy in the day. So I think that was the first thing. And then I think by the third month, I really felt I had more energy, I had more stamina, I could sleep through the night, and I just felt better about myself in general. Then I went into the phase where I started to feel like I could exercise more. I have lost some weight. I'd like to lose some more, but I've lost a fair amount of weight. I've gained muscle tone. My skin feels better. People tell me that see me now, you know, what are you doing? You know, you look great. I also just retired from my full-time job, so that's taken a little of the stress off of me. But overall, I feel great. I have a lot more energy. And if my husband doesn't come and get under his care also, he's going to do that soon because he cannot keep up with me. And as far as being frisky and sexy, I feel like I haven't felt in 20 years or 30 years. Because right after menopause, you don't want to be bothered. It's painful, you're too tired, forget it. And now I'm very interested in it again, and makes my husband happy. And I just overall feel great, and I haven't had any side effects that I know of. A couple of little tiny things, and then I'll call them up and they'll say, oh, that's fine, that's normal. But I haven't really had any problems with the level of treatment. And as I say, it's very careful. You get your blood work, come back, you evaluate it. So overall, I think it's great. I have some insurance. You know, with insurance these days, sometimes it doesn't cover all of these things, but it's really not even maybe $100 a month. And if you think about how many times you go out to lunch or go shopping for $100 a month, it's really worth it to feel great and to keep your husband happy and to make your friends ask you, hey, what's going on? So I feel really great, and I thank you, and I'm going to continue to be under your care. And I could tell you I'm 72, but to make it really look good, but I am 62. But I feel like I'm about, I don't know, 40 maybe. I feel great. So I'll stick around for a little while. I'll be happy to if anyone has any questions, but I would definitely recommend it. And it's great that some husbands are here because there's two sides to this picture too. So thank you.
Thank you, Louise.